Step one is to diagnose a current active hepatitis C infection. The first step to doing that is hepatitis C virus serology. But this will only tell you whether the person has ever been infected. To establish a current infection, you have to do a HCV RNA, which detects the actual virus. Then you need to also establish the genotype of the virus, and you can also do the viral load. When you write the pathology form, in order to get all of these results in a single hit, rather than asking the patient to go and get multiple blood tests, you can write hepatitis C serology. If positive, RNA. If positive, genotype and viral load. And all of those tests will be done on a single specimen. And that's really important because if these patients have been injecting, sometimes their veins are very difficult to access, it's traumatic for them, and if you do it all in one go, it's much easier for the patient, and it means that the patient can come back more quickly to get on the road for treatment. The next step is to establish whether there is co-infection with hepatitis B or HIV. These patients are complex, and we don't expect most of you in GP land to treat these patients, and you should refer them. So what I would request on the pathology is full HBV serology. That includes surface antigen, surface antibody and core antibody, and HIV serology. And then if there is any evidence of co-infection, refer them to your local hepatology clinic or an infectious diseases clinic or a hepatologist or infectious diseases physician in private practice. The other thing I would point out is if the patient has been treated previously with the direct acting antivirals, then you should also refer them for specialist treatment. So the next really vital step is to establish whether the patient has advanced fibrosis or cirrhosis. Not only are the drug treatment regimens sometimes different for people who've got cirrhosis, but these people need ongoing specialist review and surveillance, and that's for hepatocellular carcinoma, but also the other complications of cirrhosis. I would also not expect you to treat people with cirrhosis. Some of us do, but the key thing is that these people need to be assessed by a specialist and they need ongoing surveillance and specialist review. How do you actually assess whether the person might be at risk of having advanced fibrosis? So we look at whether the liver is inflamed or damaged, and that comes from abnormal liver function tests, but also have they got an elevated bilirubin. Then we look at liver synthetic function, and the key aspects of that are their serum albumin and their coagulation studies. Then we look at whether there is evidence of portal hypertension. A really good indicator of that is from the full blood count and if the platelets are low. If there is an ultrasound, then obviously you can pick up splenomegaly and you can see portal hypertension with retrograde flow in the portal vein. Then there are more specific tests that we can do to assess liver fibrosis. A very simple one which you can use simply with an online calculator is the APRI score, but there are also more sophisticated tests such as the FibroScan or transient elastography, and there's also shear wave elastography. However, it is also really important to get the patient's history and to perform an examination, because that might tell you right up front whether you are dealing with a patient who may have advanced fibrosis. In terms of history, if the patient is male, if they've had their infection for a long time, if they've got concomitant alcohol abuse, if they have poorly controlled diabetes or are obese, then the risks of them having cirrhosis are high. And even if the tests that we do indicate that there may not be a problem, you have to look at what we call the pre-test probability. And if you've got a concern that this patient might have cirrhosis, even if their scores are okay or ambivalent, I would actually refer them for further assessment. So the next step is to assess whether the patient has got any comorbidities. This is really about the difficulties that you could run into in terms of the treatment. So we look at heart disease, and that's really because of some of the medications that patients with heart disease have. Renal disease, that's important. It sometimes can be HCV related due to immune complexes, but also some of the drug regimens have to be altered if the person's got renal impairment to a significant degree. Also, if patients have got a really complex medical history and they're on multiple medications, that can be quite tricky. I've had patients like that and I have referred them because sometimes it can be quite tricky to work out exactly what to do with them. If you have patients who are continuing to inject, then it's really important to look after them in terms of trying to get them in the best possible place for treatment, but also to help prevent reinfection. And the other thing about people who are injecting is to find out who their friends are and get their friends in to get treated as well. And that's a concept which is called treatment as prevention. The other thing that it's important to look at is contraception, because both men and women need to be on contraception while they are undertaking their treatment. Then we're on to step 5, which is choosing the treatment. This has been simplified enormously with the advent of direct-acting antivirals, but also in the last year or two we have had the PBS listing of what we call pan-genotypic treatments. When the treatments were first available in 2016, they were genotype specific. Now we don't have to worry about what genotype they are, because we've got 2 key treatments which can treat all 6 genotypes of viral hepatitis. And if you want help in having a look at these treatments, an excellent resource is the Spot On Health HCV pathway. So many of you would have used Spot On Health before to look at a whole bunch of health pathways. Well, there is a HCV health pathway on Spot On Health. Go to medical and then go to gastroenterology. If you go down to liver conditions, and then there's hepatitis C, and you can go to that health pathway. So this brings up a whole bunch of information, probably in a lot more detail than what I have explained to you, but goes through all of the same information. So if you need a refresher, if you need some more information, then I would strongly recommend the Spot On Health pathway. The other thing that is available on the Spot On Health pathway is access to the Metro South HCV Shared Care program. And that is particularly if you don't feel confident or if you're not experienced at prescribing and you want a specialist clinic to have some oversight of what you're doing. Drug-drug interactions are a key step that you have to go through before commencing treatment. And I've listed a couple of key medications which can interfere with the direct-acting antivirals. They include the combined oral contraceptive pill, amiodarone, statins, and proton pump inhibitors, which are relatively common medications, and they may result in choosing a specific drug regimen or looking at when the patient takes their other medications in relation to the HCV medication. If you're not experienced in treating HCV, then you should liaise at least for the first few cases until you get your bearings. The great thing about these drugs is that there is minimal on-treatment monitoring. The goal of treatment is SVR, or sustained viral response, and that is assessed by checking the HCV RNA 12 weeks after treatment completion. There is 0 point in doing that HCV RNA before then, because the medication suppresses the virus. And if you do it at the end of treatment, it does not necessarily indicate that you've got a cure. So the key endpoint is 12 weeks after you've completed treatment. In order to prescribe the treatment, it's an authority. You have to ring up the PBS. And the other key thing that we have to give them is whether the patient has cirrhosis or not. It's not a streamlined authority. You have to ring up the 1-800 number to get the prescription. There are a whole bunch of places where you can get help, and I will leave it to you to have a look at the slides from this presentation to see where you may be able to get help or information or advice if you're uncertain. But there are lots of people out there who are really keen to help and get our patients treated.